So today I'm just going to do a quick video on all the sort of abdominal regions and what they mean and what they can show us. The first thing is the question is, why do these even exist? But they exist because they're used in clinical practice to describe sites of some abdominal features, for example the liver or the stomach, and then we can use it to identify where masses are or the tenderness or any reported pain in a subject. And it's important to know which organs occupy which regions, and to kind of know what the name of the regions are, and what they can show us in a diagnosis. So you've got these two right here. So you have this one on the right, which is sort of divided into abdominal quadrants, and then you've got the one on the left, which is the 9 abdominal regions. So first things first, we'll just go over the one on the right because that's a bit more easier, and we're just going to go over what the 4 abdominal quadrants shows. Right, so these 4 don't really have a name. These 4, well, these 2 lines right here on the right diagram, but we can't see quite easily what occupies each space. So you can see that this one right here, just in the corner, just over here, there's the liver. There's also gallbladder, this little green thing right here, that's the gallbladder. And of course you have the right kidney as well, but that's hidden behind the large intestine and the stomach right here. That'd be around here, and that'd be the right kidney. And of course sitting on top of the kidney there'd be the suprarenal gland as well. And of course you have the hepatic flexure, because of there's 2 flexures to the large intestine. This is the large intestine right here, just around here, and this flexure, particular flexure, is called a hepatic flexure. Then on this side we'll just label this one as well. There's a splenic flexure. That'll be on the left side of the body. And then you have the duodenum as well, which will be hiding just behind this part that we've just labeled, so just behind the hepatic flexure. So I'll just put duodenum there. And you have the small intestine, a slight amount of the small intestine. By small intestine we mean just a bit of the duodenum, and just where the jejunum will start. So that's that quadrant. And then if we go to the left upper, we have the stomach just right here. That's quite the obvious one. We have the spleen, which is hiding right behind these 2 here, the splenic flexure and the stomach. You can actually see a tiny part of it just around there, just above the C of the stomach. And that's actually the spleen, just hiding, well, it would be between the stomach and the large intestine. There's one other organ as well, and most of it actually comes here. I mean, you can see the head of the pancreas. Well, it's the pancreas, but you can see the head of the pancreas usually comes into the right quadrant, but it can also come into the left quadrant as well. Well, most of it is in the left quadrant. So for this sake, we'll just say the pancreas is in this section. And of course, you have the left kidney and its suprarenal gland as well. Don't put the right kidney in this one. Yeah, so the left kidney and this suprarenal gland that sits on top of it. And most of the jejunum now will start here. So I'll just put jejunum. Right, and that's that massive quadrant. The next quadrant I want to deal with is the colon, going down here. Of course, as the ileum is coming down, which is all this part here, that's all the ileum. It sort of occupies both. So as you have this, also another sort of thing you can use, let me just zoom in again. Another thing you can use is the umbilicus region, which is basically the belly button that sort of occupies both as well. So you have the colon, the ascending colon. Right here we have the cecum or the appendix, quite famous clinically. It's quite a famous point. And then you have the ascending colon. The cecum is just that boundary between the small intestine and the large intestine. And then we have the descending colon here. Just gonna put A for ascending and D for descending right here, and of course the rest of the small intestine. Now that's the really easy diagram done, and that's the sort of quadrants there, but we're going to move on to this 9 abdominal region right here. And with the 9 abdominal region, you actually have names for these lines, and the names for each, well, the names for the easy lines will be these 2 lines coming down here, and this is the left midclavicular line, also known as the left lateral line as well. You can call it the lateral line. Just put that in brackets. And then this got the left midclavicular line here, line, also known as the lateral line. Sorry for the handwriting, it's quite bad, but you can, I guess, see that these 2 lines are named that. And then on top of that, you've got the transpyloric plane, which will be here. Transpyloric, just remember that this is known as the transpyloric, and as you can see, it crosses the pylorus of the stomach. So yeah, that's how you can kind of remember that one. And this one down here is the transtubercular plane. Tubercular plane or line. Yeah, I should have said line. Plane is a bit more better word to use for each one of these, to be honest. But if it helps, to call it the line. Anyway, so these 9 regions actually have a name, and I'm just gonna fit the names in without taking too much space, so we can label the organs. So the first line, first sort of corner will start here on the right, so the right side of the body, so it's the right hypochondrium. Sorry, it's going into this one. This one is the epigastrium, and this is the left hypochondrium. Like that. And then you've got the right lumbar. Just remember this region is the lumbar region, and this sort of is near the spinal cord, where the spinal cord, the lumbar region of the spinal cord. So that's how you can remember this one. So you got the left lumbar here, and the middle where the belly button is, that's going to be the umbilical region. Because remember, as I said, the belly button and the umbilicus sort of tie in there. So you have the right iliac fossa, also named aptly because this is the ilium, sort of so where the ilium sits, most of it anyway, that's going to be the ilium of the small intestine. And so that's that. Then you got the left iliac fossa right here. That's really bad. Oops. Okay. And then you got the hypogastrium. Okay, so what sits in each one of these? You've got the liver and gallbladder, obviously pointing to here. So liver plus gallbladder is basically the other diagram that we've just done and split into smaller sections. You have the suprarenal and right kidney also sitting here. Mostly the suprarenal gland sits into this one. I'll just call it the SR gland for now. and that most of it actually sits into this region. And then this one, you've got most of the liver in the epigastrium. Just label each, underline each one of these. So you've got most of the liver sitting in there. You've got the abdominal aorta as well, and you've got the vena cava as well, vena cava, however you want to pronounce it. And you've got the pylorus, the very important pylorus. And yep, and then you've got the part of this region has the duodenum as well, but that mostly comes underneath. Anyway, so you have the stomach in this section. You have a spleen that sits on the left side of the body, of course, and the splenic flexure of the ascending colon. The splenic flexure is actually quite a bit more interesting because the splenic flexure sits a bit more higher than the hepatic flexure, even though it doesn't show on this diagram. It does go a bit more higher because the liver pushes down the hepatic flexure a bit more, so it sits a bit higher in the body. Anyway, so you've got most of the kidney in this region, and you have the colon as well, the ascending colon, and some of the small intestine right here. So I'm going to just put intestine. And the umbilical region, you have the duodenum. Most of the duodenum now comes into here. A lot of the pancreas, the head of the pancreas, the starting area, all the way to the end will be in this area as well. And you've got the inferior vena cava and the ascending, the abdominal aorta. I'm just going to put IVC and AA. Of course, you have the small intestine as well, which covers most of it. So that would be the ileum. I mean the jejunum, sorry. Jejunum. Ignore that. Just rub that out if I can find. No, it's not doing it. Anyway. So yeah, the ileum sort of sits here. So I'm just gonna jejunum, sorry, jejunum. Right, that sits there, and you've got a lot of the jejunum sitting in this section as well. Obviously, you have the descending colon here, and you have some of the pancreas in this region as well, like the tail, the end part of the pancreas, and a bit of the spleen, tiny bit of the spleen comes into this region. So here we've got the cecum. Sorry, some of the recording went off, but with this you can so I've just labeled this corner right here, so you can see the cecum, the appendix, and the small intestine all sort of come to this region, and it's quite important clinically. Here we've got all the spermatic cord, the small intestine again. I'm just going to put that in, intestine. Some of the sort of reproductive organs, we'll put that in, reproductive organs. And some iliac, so we'll put ileum here, so iliac vessels. And then here we've just got the sigmoid colon, which is also important clinically, and we've got the jejunum as well. Oh well, part of the jejunum is actually the sigmoid colon, which just says small intestine, so small intestine, yeah, some of it comes in. And yeah, that's all them parts. I'm just going to give a little bit of an overview with what you can actually palpate. And with the gallbladder, sorry, not the gallbladder, the aorta, you can sort of feel the aorta in the umbilical region slightly pulsing, but it's quite difficult to feel. It's mostly the heartbeat, it sort of overtakes that strength of that pulse. And then you've got the descending colon in the left lumbar region, and you can sometimes feel it if it's quite full. You've got the liver, that's usually palpable on an infant, on this anterior inferior edge. The spleen, which is usually also palpable on an infant, and the gastrointestinal tract, usually if there's constipation only. The urinary bladder, you can actually feel it only if it's really full, and the kidneys are palpable in some subjects only if they're really thin, and they've lost quite a lot of weight. But if you sort of put your hand on the right or between the right the right hypochondrium and the right lumbar region, so these two, you can sort of feel the kidney. If you push down the front, then put your hand onto the back side, so the posterior region, just around here, you can sort of feel the kidney bouncing as well. So the kidney is kind of palpable, but you can't feel the bare area of the liver in some subjects. It's also it's more noticeable if it's swollen, or if it's there's some sort of reason, medical clinical reason for it to be sticking out. And the spleen is also palpable, but only the tip of the spleen, and you can't really feel it in most subjects as well. So that's all the sort of palpable regions that you should know about. But yeah, that's about it. That's a quick video on just this little section. It's pretty much everything you need to know on this little quadrants.